Climate change is one of the major public health challenges that we face in the coming century. It isn't just climate change, it's global change writ large, with changes that are associated with climate change, ocean acidification, loss of biodiversity, alterations in the global cycles of some nutrients and elements. But put it all together in that global perspective on the determinants of human health is extremely important. If we don't get this right, we face enormous challenges to public health. And if we get this right, we have a healthier, safer, more happy and fulfilled public around the world. One of the areas I'm passionate about is the built environment. Those are the places where we spend our time, from the small scale of buildings to neighborhoods to larger communities to entire metropolitan areas. It doesn't sound like public health, and it doesn't sound like climate change, but it's really the nexus of those two domains. If we build places in a more thoughtful, environmentally sustainable, and health-promoting way, then we win both with respect to climate change and with respect to health. So energy-efficient buildings use less energy, contribute much less to climate change. And those very same buildings, by providing irresistible staircases, by reducing the use of toxic materials, by taking advantage of natural daylighting, create healthy, health-promoting human habitat. So I work at the interface where we look for win-win solutions, no-regret solutions, both for climate change and for health. Another area where I work is in nature contact. It turns out that contact with the natural world is very good for people. It's psychologically restorative. We have evidence that it gives benefits ranging from rapid healing after surgery all the way to improved cognition and affect, both in people with mental illness and in people who are free of mental illness. Nature contact is good for people. We can also get lots of climate benefits by prioritizing nature contact. So tree canopies in cities are attractive. People like them. They're spiritually fulfilling. But they also help by reducing the urban heat island. They help with stormwater management. So this nature contact story is an appealing story. People from across the political spectrum get it and like it. We need to get people outdoors more for the sake of physical activity. And at the same time, that's an area of effort that will help us with climate change. One of the most important features of our tackling the climate change challenge is also one of the most important themes in public health, and that is equity. We know that the impacts of climate change won't affect everybody equally. Some communities, some individuals are more susceptible than others. The very same theme is at the heart of public health. Not everybody is equally susceptible to public health problems, to health challenges. So in our efforts to deal with climate change and using our insights as health professionals, we need to pay special attention to the most susceptible populations and be sure that we have equitable solutions that protect them from undue harm and that across the board help people withstand the effects of climate change. The teaching that we do about climate change, climate and health, needs to remind people that there is a lot of basis for hope. We have a lot to do. We have to roll up our sleeves and get to work, and we have to do that across our society. Health professionals can lead that. But above all, we need hope.